Welcome to today's episode of Molecules to Medicine podcast. For those of you just joining the podcast, we are AI Jules, and we specialize in helping healthcare and life science companies scale their business and revenue and explore how AI is reshaping the industry and accelerating innovation. So, if you'd like to learn more about how to take your business to the next level, then make sure you stick around. And if you're interested in a free growth consultation, just drop us the word growth in the DMs and we'll get back to you. I'm your host, Hardy, and we have a very exciting guest for you today. Aaron Zach, the co-founder and CEO from RRSP Industries. Welcome, Aaron.
Thank you so much, Hardeep, and thank you so much for having me on this podcast. I think it's great, really, to hear from different people and different backgrounds and perspectives, especially how to adopt AI into real-world translation, which is a current gap that we're facing today in healthcare. So thank you so much for having me.
No problem. And where are you talking to us from today?
Well, I'm actually joining from Kuwait. So originally born in New York City, kind of lived all over the world, worked all over the world, but currently located in Kuwait. So thank you so much for having me in Kuwait.
No problem. And nice sunshine there as well, I assume.
Yeah, it's nice to be in a climate that, let's just say, is more or less moderate all year round.
Fantastic.
You know what to expect.
Yes. So, Aaron, tell us a bit about your background and your journey and what led you to RSP Industries and any pivotal moments or experience that shaped your career.
Yeah, no, it's a great question. So I originally started my healthcare career as a paramedic in New York. I've worked all over New York, including New York City and upstate New York. And early on in my career, I had to move around a lot. Didn't really know what I wanted to do. I was young. I knew I wanted to help people. I knew I wanted to do it at a personal, practical level. Kind of fell into EMS, which was, for me, first day I stepped foot on an ambulance, I knew I loved it, and did it for free, right? I volunteered in my early portion of my career as well. And I moved early on in my career, moving around a lot, forced me in different healthcare systems, even doing the same job. And in certain healthcare systems, let's just say certain regions operate in a very unique and specific way for the reason that they need to, whether if it's rural, urban, whether you need to request a helicopter or not, you need to take in different considerations. And when I was learning the job and then being forced to learn different ways of thinking, I quickly learned that instead of trying to learn how to do the job, I tried to ask why. Why are we doing things this way in different areas? And I didn't know at that time how pivotal and impactful that would be to where I am today, early in my career. But that question of why are we doing things this way? Why are certain protocols written in a specific way? Why is the philosophy and thinking about medicine in a specific way in a certain area based on that the system is facing really kind of shaped my current career path into conversation we're having today. So anyways, I fell in love with EMS, really liked it, worked my way through paramedic school, became a paramedic, worked my way through being a paramedic, did all the different types of source, critical care, community paramedicine. I've worked in West Africa, I've worked in Eastern Europe, I've worked in the Middle East as well. And so getting a taste of the international community and seeing how things operate in foreign countries really opened my eyes. And actually opened my eyes to the opposite effect, where most people say you can't compare healthcare systems. I would challenge that. I think there's a lot of overlap within healthcare systems. And so that's what I started really focusing on and thinking about, through my career from a bottoms up approach. And obviously there's a top down look when you come into healthcare and healthcare administration and economics. But from a bottom up view is where I started my career. Then I went to medical school, couldn't afford to go to medical school in the US, so I decided to study in Poland and went to the Medical University of Gdansk, completed the didactic material, and then unfortunately the COVID pandemic happened. A member of my family got sick. I had to step away, take a dean's leave, which turned into a withdrawal, helped my family back home, but started on this career path as an entrepreneur. So when I was in medical school is where I met my co-founder. His name is Dr. Alex Grzeszka. He's currently working in Switzerland at the moment. And we both, kind of just started as, I would say, as a side project, an escape project from school. We started looking into different technologies and tools that we could use in healthcare, just started kind of discussing them on the side, spoke to some professors, spoke to some doctors, got really positive feedback. And we thought, okay, what's really missing in the healthcare system? Not just what's missing, but we kind of saw early on there was this fork in healthcare technology. And this fork in healthcare technology was, we felt that the innovators, the researchers, engineers that are developing tools don't really understand the core problem that's needed within the healthcare industry. And it is actually shaping the workflows in a specific direction without them even knowing it intuitively. Instead of getting frustrated about that problem, so why not try to do something to help solve it? And we said, okay, we could talk about different devices and single point solutions, which are great. Probably more competent people who are working on these devices, and we are more experienced, I would say. But what's really missing is something that could bring it all together, a glue, right? An intelligent platform. And so that led us to develop an AI integrated patient centric platform that connects patients, EMS, and hospitals and allows EMS to operate at maximal efficiency for day to day operations, but also meet large scale incident response. And so there's been a push in healthcare to drive community health or healthcare economics, reduce bottlenecking and surging in the emergency departments and in the hospitals. And we saw, just from my experience, like I said, working in EMS in the pre-hospital environment, working in different healthcare systems really around the world, where we saw there is an underutilization of current resources, so the emergency medical services. And part of that underutilization is really tools and technology that can help them operate at the most efficient level. And there we saw lies the key into how you can create a healthcare ecosystem and make it robust, whether if it's disaster response, large patient surges, tapping into patient surges. We can talk about from just a technology perspective, the limitation of data collection and why that's important. Because if you talk about collecting data from a geolocation and dense populated area, then you can map out the patient trajectory and allocate, resources along the patient trajectory in an area where you could really help the healthcare ecosystem. So instead of taking a hospital or EMS service approach in our technology adoption, we shifted it to a patient-centric approach, where we could look at the system as a whole, and it lets us look at the system as a whole. So that's where we are currently today. We did develop a free tool for emergency medical services to be able to forecast patient surges based on date and time. It could be adopted in clinics and the emergency department as well. And we are currently working with some hospitals and emergency medical services in the United States currently, where we are looking to demonstrate the deployment of this tool through using community EMS, the local hospitals, and integrating them with the community health service provider that's taking care of this patient for patient-centric patient.
Fantastic. Very comprehensive, detailed information there. So just because there's quite a lot there. So is it essentially an AI tool that talks to various different systems within a healthcare system?
Yeah. Yeah, so that's a good question. So yeah, I think I wouldn't want to call that at the core, but what I would say is this. So instead of trying to develop a tool that we have to sell to the user, because the payer is the real beneficiary, the or the adopter is going to be the administration from the EMS and the hospital, and then the end user has like really no say here, right? So what we ended up doing is we thought, okay, instead of trying to now sell a tool, why not enhance the current service that exists and fill in the gaps, right? To avoid redundancy. So we found a community health service provider that actually understood the pre-hospital environment like us. I was very shocked. It was founded by an MIT engineer, and they're developing not just community health service program, but already have the infrastructure to integrate different IoT wearables and monitor and manage the patients. So where we came in is we said, okay, what's missing here is we can add value by bringing in community EMS. And by bringing in community EMS, it allows the community EMS to tap into revenue or reimbursement models they weren't able to capture previously. And therefore also connecting them with the hospital, so with Epic. And that's done really with our partner with the community health service provider that has the infrastructure to collect the IoT wearables. They're connected with Epic. And where we come in is we just provide the glue, bridging community EMS and then providing the platform for monitoring patient surges and forecasted demand with EMS so they can handle their day-to-day operation, but also linking that to the hospital in their emergency department for triage as well.
Okay, so is it talking to the EMS system and to pull data out of it?
Yeah, so it's pulling data out of the EMS system, but primarily out of actually the patients. So we're capturing the patient data, pulling system there, then capturing or merging with the EMS data for obviously covering gaps there, and then providing them just a view of how to operate more efficiently, putting more ambulances on, taking ambulances away, relocating ambulances for what's needed to meet the community EMS side and their emergency side based on their resources. So pulling from both.
Okay, so it's streamlining the operations in terms of the emergency services. Is that
Correct,
accurate?
correct,
Yeah, yeah.
correct. And that's where we're starting. And then we would like to bridge that to then streamlining from the emergency department as well.
And does this take into account any payments from insurances or anything?
Yeah, so that's a good question. Our platform directly, oh, we're not doing that, but with our partner with the community health service provider, because the billing is done through them. We just help ensure that the community EMS can capture different parts of that reimbursement. So there's multiple chronic conditions care management codes that they can tap into, which is reimbursable by the minute by Medicaid. Certain states in the United States have hospital at home reimbursement set by Medicaid. Other states, you kind of have to do some work to get there. But through this connectivity, now they're also able to capture in the hospital home reimbursement and also value based care. And so value based bonus reimbursement as well. And now that they could be part of that. So that's the overlap to public health services. So a lot of people think that you can't compare US systems with European systems. That's an open conversation. It really depends on which way you're looking at it. But if you want to cut short to the economics, doesn't matter who the payer is. It could be public, it could be private, regardless. They just want to see patient improvement and they just want to see reduced costs to deliver that care, right? Through patient health. So in the US, that's referred to as value based, and the incentive lies within the hospital to meet certain quality care metrics, which we're helping them meet through this initiative. So hospitals can utilize the community health services and community EMS to help meet certain quality care metrics. But along with then in the European setting, where I just think it's pretty evident to where the overlap is.
Fantastic. And can you share any real life examples of how customers have used RSP Industries to achieve meaningful results?
Yeah. So currently we have a few users with our free forecasting tool from different EMS agencies located within Europe and primarily Switzerland at this time. And they seem to really enjoy it. They just would like to see it being adopted more at scale within the current tools that they're using. So that's a next step that we would like to do. But we wanted something that could be quick and dirty out there for free for anyone to adopt. And then currently in the US, where just coming on approaching the first deployment of our pilot in a few different locations in the state of Michigan, state of New York, and Connecticut. But so far the talks have been going really well. They're really excited, really happy. It's the perfect time because I would say from just community EMS side in the emergency medical services, sometimes there's, let's say, limitation in terms of administration bandwidth. And so we really help reduce a lot of the administration bandwidth, and not just for emergency medical services, but for clinics and hospitals as well. So there's been a lot of really positive and excitement for our first deployment.
Okay, great. And what's been the biggest challenge or bottlenecks you're facing with getting your product?
Oh, that's a good question. So for me, initially was always a learning curve, but I would say the biggest challenge is really you have to connect the dot in so many different people with different backgrounds, people with different understanding, people with different needs. So really honing in on who you're talking to, what's their interest, where is their incentive that's lying, I would say is really the biggest challenge. And sometimes you have to get them to see where the incentive is for another person. And that's I think always the biggest challenge. So
Mhm.
anytime you create a solution where the payer customer is not the adopter, where it's not the end user, you're always going to face challenges in terms of the adoption, especially when it bridges to new pathways of care that, anytime there's something that's new, people I think have difficulty adopting it. But sometimes you just have to show the golden nugget.
Yeah. And where's the biggest opportunity for innovation or impact right now? And looking ahead, what excites you most about the future?
It's a great question. So I think the biggest opportunity impact for what we're trying to do is not so much what I was describing, but how this platform can really set the stage for new pathways of care, new tools and technologies to be adopted in the pre-hospital environment. It can really help solve a lot of the limitations for what, people are really talking about in healthcare, trying to drive community health, hospital at home care and delivery, emergency department reduction in bottlenecks and patient admissions, where we can now start providing the infrastructure where we could take in hospital care and start really delivering it at home and at a much higher level and hopefully more acute level as well as we take on.
Okay, and great. And so what stages are you at right now? What does growth look like over the next 12 months?
Oh, that's good. So yeah, to tie this back into where we were asking before is we're looking at the second half of this year, starting our deployment in 3 states. The state of Michigan, New York, and Connecticut, where we've been speaking with different EMS services and hospitals. And through that, there's also a rural health transformation grant that was passed on through the states within the U.S. And so that should be dispersed by middle of this year. And so we're hoping and anticipating of getting that with our partners that we've been speaking with. And I think the most exciting part is we've already been discussing with the American Heart Association and the NIHR in the UK, where we can do a dual study for at-home cardiac rehabilitation, leveraging emergency medical services to divert regular cardiac rehabilitation, but providing it at home. And with a little bit of education for EMS, or in the UK, alternative care pathways, and providing the tools, infrastructures, and models to really be able to accomplish that care well. I think that's really exciting. And the point of doing it in 2 different healthcare systems is to not just compare the patient outcome, but also the economics. Defining the solution where it can be deployed in 2 completely different healthcare systems with 2 completely different, let's say, economic infrastructure. Again, honing in on the core, I think we can demonstrate that. So for me, that's the most exciting part over the next 12 months.
Okay. And is it hospitals that you need to target in terms of promoting the business to be able to take this on? Or is there any other avenues that you can approach?
Yeah, so that's a good question. I think the avenue we've been taking now is the community EMS side and targeting them, and then our partner community health service provider has been targeting the hospitals, and so we kind of are that glue, and that just helps us for our stage. But ultimately, really would be the payer, right? Large healthcare systems and the payer that we would really like to target that would create large exponential growth for us.
Okay. And in these community settings, I mean, just in a state wise, how many different potential partners could there be in a state in that community setting?
It could be there could be several. So outside of just the hospital EMS and then the actual community health service provider, then there's different community care centers that are usually county based that the state or county tend to service. And there could be upwards of, let's just say, several more. It can easily double, triple the amount of partners, right? It could be a community care center for mental health. It could be for the mentally challenged and handicapped, where they're coming in for day programs, or they could be residential programs. And so there's multiple partners that can be involved here.
Fantastic. And which growth channels are currently working best for you?
Currently, the growth channel that's been working the best for us is going directly to the EMS and allowing our partner to bridge the hospital and clinical side.
Okay, so they go directly to the EMS.
Correct.
Okay.
Correct.
And how many different EMS systems are there in the US?
It's an unfair question, because if you say EMS systems, you would have each state operates independently, and then within the state, every city and county can operate independently. But some states are county based, some states are blended, let's say. So
Yeah.
it could get complex there, going into the weeds. But the advantage for us is there's certain providers that are nationwide or larger, and they have a larger coverage area. So we've been targeting them as well to kind of limit the number of initial potential.
Yes. And sorry, that was the question. So how many large providers are there that cover the US globe?
Yeah, so There's one large, probably the largest would be AMR, American Medical Response, which is a subsidiary of Global Medical Response, and they would probably be the largest. But then there's a lot of other groups that don't keep the group name. They let every agency that they've procured operate under their independent name, so it becomes harder to identify. But that's pretty much been an emerging trend with EMS over the last 5 to 10 years.
Fantastic. Well, thank you very much, Aaron. Very interesting to learn about RRSP Industries. And where can people learn more about your business or get in touch with you and your team?
If you want to look us up online, you could look us up at rrspindustries.com or contact me even via email at aaron, aaron dot zak, zak at rrspindustries.com. You could look us up on LinkedIn as well, and feel free to reach out if anything we said may have been of interest to you.
Well, thank you for your time, Aaron, and all the best with RRSP.
Thank you so much. And again, thank you so much for having me, Hard Deep, and I wish you the best of luck with this podcast. And again, I think it's great having people from different backgrounds, different experiences to really help give their perspective in the emerging trends of not just AI, but translating the development of AI into real world adoption for real benefits. So thank you.